Hey, Matt McGorry here, teaming up with the NYC Health Department to set the record straight on 4 myths about COVID. Let's do it. Myth number 1, COVID is mild now. Fact, your overall risk of long-term health issues increases with each new COVID infection, even if your symptoms are mild. So even if you were fine after your last infection, you're still at risk every time. Did you know that 1 in 3 adults in New York City who had COVID have reported experiencing long-term physical or mental health effects afterwards? Personally, I've only ever had mild symptoms when I got COVID, but repeated infections left me disabled with a long COVID diagnosis. The truth is, it's still worth protecting yourself. Myth number 2, you may have thought, I feel fine, which means I don't have COVID. Fact, people can spread COVID before they have symptoms, meaning they don't know they're sick yet, but still may be contagious. Also, this is wild. I only recently learned that asymptomatic infection is also common, where people won't get any symptoms at all from a COVID infection, but can still spread it. Some studies have suggested 20%, others 40% asymptomatic spread, depending on different factors. Whether it's before you're symptomatic or you never get symptoms, you won't always know you're sick, but you can still infect others. That's why precautions like wearing a mask, especially in public, helps protect everyone, even if you feel fine. Myth number 3, only high-risk people need to worry about COVID. Fact, anyone who gets COVID can get long COVID, including young, fit, healthy people with mild symptoms. If Olympians, elite athletes, and U.S. Marines can get it, so can you. A lot more people are at high risk for long COVID than you might think. For example, people who are Black, Indigenous, Latine, trans, queer, poor, women, pregnant, those who have depression, higher body weight, diabetes, high blood pressure, and more. I didn't consider myself high risk, but I still got long COVID. Myth number 4, social distancing and hand washing alone stops the spread of COVID. Fact, COVID is airborne and the majority of the time is spread through the air. We initially thought that COVID spread mostly through larger droplets that fall to the ground within a short distance, hence the 6-foot rule. But we now know that it also commonly spreads over larger distances via invisible airborne particles called aerosols that move like smoke, lingering in the air. The risk of getting COVID from surfaces is thought to be very low. Early studies suggest that less than 1 in 10,000 contacts with a contaminated surface would result in the chance of infection. Still, hand washing is always a good layer of precaution to protect from viruses. Because COVID is airborne, when you're around others, a well-fitting mask like an N95 is the best way to protect against getting it or spreading it. The simple fact is, the only way to prevent long COVID is to avoid getting COVID in the first place or to limit the amount of times that you get it. The best way to lower your risk is to layer precautions like masking, using HEPA purifiers, improving ventilation, and staying up to date on your COVID vaccine. So stay safe and mask up.